This is the Human Action Podcast, where we debunk the economic, political, and even cultural myths of the days. Here's your host, Dr. Bob Murphy.
Before we jump into the interview, folks, let me remind you the Mises Institute has a special December book bundle available now. For just $25 or more, you'll receive 3 essential reads: Tom DiLorenzo's Axis of Evil, America's 3 Worst Presidents, Per Bylund's How to Think About the Economy, and Murray Rothbard's What Has Government Done to Our Money? Support the Mises Institute and expand your library with these thought-provoking works. Now, this offer only runs through December 31st, so claim your bundle now at Mises.org/humanaction24. Again, donate $25 or more to secure this exclusive offer today. It's only available through December 31st. You go to Mises.org/humanaction24. Okay, let's get into the interview. Well, Keith, welcome to the Human Action Podcast.
Thanks for having me. It's always fun to talk to you.
Yeah, likewise. So on these episodes, Keith, Dr. Smith, on this episode, we don't do, or this podcast, I should say, we don't do a pre-recorded introduction. So I'm not going to be able to give the listeners who don't know who you are an explanation of who you are at the Surgery Center of Oklahoma. And especially because it's so relevant to what we're going to be talking about. Can you just explain, and don't be shy, like go ahead and, feel free to take some time just to explain what it is that you guys do, what your particular specialty is, and also maybe just give some real world examples so people understand, like when you are able to deliver procedures at a lower price, like what kind of savings we're talking about.
Sure. So I'm Keith Smith. I'm an anesthesiologist. I have a full-time anesthesia practice. I started my private practice in 1990 here in Oklahoma City, and it did not take long for me to realize that the medical practice that I'd hoped for was not really coming to fruition. It became very clear that it was extremely difficult to take care of patients without the interference of many outside factors, government included. It also became very clear that hospitals were not my friend. They weren't any physician's friend, and that the physicians really were pretty disenfranchised. In 1992, George Bush, the elder, decided to inflict a tool on the industry called the resource-based relative value scale, which really unmasked the complete control over the industry for which the government had lusted for so long. But essentially, in collusion with some economists at Harvard, they decided they could place a price on every single service provided by a physician. And the hubris of this, obvious to the audience on your show. So they got them all wrong. They got a lot of them. They were too high. And so there was a proliferation of an abundance of availability of procedures for which Medicare decided to overpay. Likewise, no mystery, there was a shortage of a lot of procedures that were underpaid. Anesthesia, cardiac anesthesia in particular, my specialty being one of them. So physician fees fell drastically at this time. Just to give an example, as a cardiac anesthesiologist, I was paid $1,100 for the service I provided for an open heart surgery from 1990 until 92. In 92, with resource-based relative value scale infliction number 1, that was cut in half. So I was paid $550 after that. Not satisfied that the cuts had been drastic enough, the government, and I believe this was under the Clinton regime, inflicted part 2. So the last open heart surgery for which I provided anesthesia service, I was paid less than $300. The last Medicare beneficiary I provided anesthesia to for a knee replacement, I was paid $78. And I'd become familiar with the Mises Institute and Ron Paul, and had done enough reading about economics at that time to realize that this was not personal. These are prices, these are signals in the marketplace. And these signals were telling me what they thought I was worth. And I thought it was only rational of me to respond with a signal of my own. So I quit. And I didn't quit taking care of Medicare patients. I just quit filing claims. I didn't want to legitimize that system, which I'd come to believe by that time was a Ponzi scheme. But I also realized the government didn't have any money, and I was the recipient of stolen property if I did accept that money. So I began ideologically really to mature, and my thinking about the world and economics was being radically challenged by not being paid for complicated services that I was providing. But simultaneously, I saw the administrative staff of the hospitals where I worked, Bylund. They were building on to the hospital. There were many more very expensive suites in the hall. They were buying out hospitals that were their competitors. They were buying physician practices. They were sponsoring sports franchises, college and professional. There were billboards going up everywhere. And simultaneously, these so-called not-for-profit hospitals were complaining that they were going broke. The poor mouthing continues to this day. So it was clear they were making wild amounts of money. Physicians were being shortchanged. And then in the old days, a physician could go to the medical records department and look at a chart. And on the right side of the paper chart was all the clinical information. On the left side was all the financial information. So it became very clear that patients I was anesthetizing for routine procedures, tonsillectomy, carpal tunnel, gallbladder, those patients were being bankrupted by these hospitals with the bills that they were being sent for very routine procedures. And I began to feel like an accessory to a crime. Mm-hmm. And so a like-minded anesthesiologist and I walked away in 1997, just sick of being part of this and knowing really in our hearts that we could do things cheaper and better. We walked away and we bought a burnout surgery center that was about to fail. And we actually bought it on a hunting trip. And we opened up in May of 1997 with the mission of providing the best care possible at a reasonable price. We also pledged we've never accepted dime money from the government and that patients would always know prior to arrival what they were going to pay us. The most awful part of all of this prior to our departure was that these poor mouthing hospitals, in order to legitimize their narrative, they began denying physicians, surgeons in particular, the tools that were required to take care of patients. So it was time to get out, and we did in 1997. I'm not a businessman. Our pro forma was, if they're charging $30,000 for a carpal tunnel release, we think we can do it for less than that and maybe better. And we had no idea how correct we were. So we started quoting prices over the phone the first week we were open to patients who called with no concept of how radical that was. We weren't just quoting prices for the surgery center. We were quoting all-inclusive prices, which included the anesthesia and the surgeon. And we were only to discover as time went by that these prices we were quoting, which were profitable prices, were 1/10 or less than that of the so-called not-for-profit hospitals. We were attacked, as you know, just mercilessly by the hospitals who we embarrassed with these, very, very affordable prices. We were attacked by the insurance industry, which we didn't understand at the time because we were out of network with all insurance plans. They all hated us. We were attacked by the state health department here in Oklahoma. And all of these attacks backfired. The legislators, particularly the Democrats, saw us in Oklahoma as an underdog. The Republicans were all bought off by the big hospitals, and they were the ones really that were attacking us. But the Democrats saw us as a champion of the poor, the affordable prices. And, I'd walk into their office and tell them I didn't want their money. I didn't want anything from them. I just wanted to be left alone. And that message resounded with them. They really liked it. So our first defenders from the vicious attacks were people you would say were on the left. The Republicans came on later when waving the free market flag seemed like a popular thing to do. So anyhow, things went along great. We built the huge facility we now occupy in 2003. And then the insurance commissioner and the carriers and the hospitals stumbled on a way to hurt us. They stacked deductibles. And what that means, now we were out of network with everyone, and we were filing out of network claims for patients as a courtesy. But what they did is they disallowed any insurance benefit for a patient who came to our facility out of network unless they had already met their in-network deductible. So they stacked these deductibles on top of each other, which put us out of financial reach for many of the patients that prior to that time would come to our facility. So our waiting room emptied. Lou Rockwell's laughed at me that there is such a thing as a waiting room. I think that's fun. But it emptied. And I mean, we almost went out of business. And I remember thinking at the time, we're cheaper, we're better. In a free market, there should be a line around the block. I mean, we should be as busy as anybody. And so in 2009, almost in a last act of defiance, I posted all of the prices we'd quoted over the phone up until that time on a website. Also, not with no clue really at the time how radical that was and what the effects would be. I did have 3 goals in mind, though, when I did that. One was to make us more visible to patients who had sticker shock. They had a high deductible or no insurance, a member of a self-funded health plan, a member of a cost-sharing ministry. I also wanted to start a price war because I was mad. This was too hard being a doctor. It's too hard taking care of patients, and just trying to run us out of business constantly. And I was pissed. So I thought, these so-called not-for-profit hospitals that are charging 10x what I'm charging have got some explaining to do. And I want someone who lives in Iowa or Maine or California to print my price and walk into the hospital and say, match this or I'm traveling to Oklahoma City. We really wanted to start that. And the last thing is I wanted to understand or better understand some of the scams at play that kept the market from functioning as it should. And I would argue all of those goals have been achieved. So that's kind of our story and how I did it and why I did it. And it's been a wild success.
Okay, so just to make so people understand, so by you doing that, then is that what solved your problem and you guys flourished because now you had people literally flying in and getting operations there once you went public with your pricing?
That's right. So post the prices, and the first patients to take advantage of it were Canadians. And that was instructive in itself. These are people that have coverage, whatever that means. They just don't have access to the care many of them require. We have 2 Canadians this week having surgery at our place. So, yeah, uninsured patients traveled from out of state. And then I became acquainted with people in the self-funded industry. So employers in all 50 states will fly their employees to Oklahoma City, pay all their travel expense, them and a companion, lodging, incidentals, pay all the surgery expense, waive all out of pocket, and they still save just vast sums.
Yeah, I remember you explaining like a typical case where it would make sense for someone to, fly, like you say, bring a companion, and then recover like in a local hotel for a week before they, should travel again, wherever they got a hip surgery or something. And still, that was just a lot cheaper than what they would pay, even though they had, quote, good health coverage. Like even just what they would be on the hook for, let alone, what the official price was that their local hospital was charging the insurance company.
Yeah, that's exactly right. We see someone that needed a carpal tunnel release. That's a very minor surgery. And they would fly to see us from Idaho because they were going to have to pay $10,000 or $12,000 for this procedure. And I think my price on the website was $2,950 for everything. Mm-hmm. And so, yeah, they could afford to fly to see us. The latest trend, which I can say is a trend because we've seen this more and more, are the denials that patients are facing. Those that have what they thought, was good insurance, even people with Medicare, they're just being denied the care that they obviously require. We had a very well-to-do developer who had, a Blue Cross plan that he just thought was wonderful. Well, he had a torn meniscus and a locked knee. I mean, he couldn't walk. And they said they needed 3 weeks to review all of his medical records before they could provide payment authorization. He just came and paid our cash price, which I think was $4,000, surgeon, facility, anesthesia, and got his procedure done the next day. And he had a bucket handle tear of his meniscus and a locked knee. So we're seeing more and more patients that have insurance, but have just thrown up their hands in frustration because they can't get the care they need.
Okay, well, so thank you for that quick summary. And so now that the listeners have more of a context of who you are and why I wanted you for this episode, let's just review. So, of course, the shocking events of the last few weeks, the apparent assassination of Brian Thompson, the CEO of UnitedHealth, and Luigi Mangione's been arrested as the alleged suspect. And he has this manifesto. And one of the things early on in this is this claim that, hey, the U.S. spends the most in the world on healthcare per capita, and yet its life expectancy is like 42nd. And so this was taken as proof among, progressive fans of the shooter, whether it's Luigi or not. I know that's a controversy online right now. To say, yeah, this guy's a hero standing up. These health insurance companies are basically murderers, and this is just a guy fighting back. And just basically, hey, look around the world, you idiot Americans. Can't you see capitalism does not work when it comes to medical care? Like, a lot of them probably don't think capitalism works for anything, but they say particularly it's crazy that it's the profit motive that is making healthcare so expensive in the U.S. and we don't even get anything for it. It's not like we have better healthcare than the Europeans do. So a lot there, I realize, but I think, you're the perfect person to just help us walk through this and understand, there's obviously some element of, you can understand why people have that reaction given the horror stories that you've seen and that many of us have experienced, but yet presumably you don't think that, yep, that's right. It's basically capitalism is the problem here.
Yeah. The problem is not the free market. The problem is the absence of the free market. The problem is there's not enough competition. And that's why the prices are what they are. The other problem is there's so many variables and moving parts that are not considered by those who make these claims. If you take car wrecks and homicides out of the number, then the death rate changes drastically. And there are a lot of places, a lot of countries where people don't drive cars like they do,
right.
In Texas and California and all over the United States. The other thing is,
Hey, Keith, let me just stop you because that's a critical point. I just want to make sure people didn't miss that. So you're saying that, yeah, like one leg of that 1-2 punch critique is to say, look at how much the U.S. spends and what do we have to show for it? Life expectancy is like 40 seconds, something like that. And among, OECD nations, it's not very good. But your point is a lot of what's driving those headline figures is that many Americans die in automobile accidents and from gunshot wounds. So, we can talk a separate conversation about why are there so many shootings, but clearly it's not the fault of the healthcare system if more Americans tend to get in car accidents than Europeans do. Like, that's clearly not the fault of, our operating rooms or something.
Yeah. And the other point that undermines that argument is the overall health of people in the United States. People in the United States are more affluent and they eat more. And so, and they probably don't eat as healthy as they do in some countries. So, and that's not the fault of the healthcare system. That's not. Now, is that a reason that more is spent? Yes. But the other thing you have to keep in mind is the extent to which our culture in this country is geared toward making sure people don't perish when they might survive with a care intervention. And many of those interventions are just simply not available in countries, and they don't really count those against the mortality. There's an extremely aggressive euthanasia movement in Canada and in the UK. You get diagnosed with a chronic disease at a certain age, that's problematic there for your survival. They don't count those against mortality statistics at all. Or newborns, that are premature. There are heroic efforts in the United States, and there are all over the world, but particularly here, to ensure that those little babies survive. In a lot of countries, they don't count. They don't count those in the denominator. So, that you take all of those things into account. I'm not a mathematician or a statistician, but I know those variables move the needle way off of 42nd in the world.
Mm-hmm. Okay. So I guess big picture, is it like, is it true that like a very wealthy person who's got something that requires very expert care, are they necessarily coming to the United States? Or is it like, no, you could there's 10 countries, or maybe if you say you're not sure. I mean, obviously I'm not expecting you to be an expert on the world's healthcare systems.
No, I know for a fact, I would say I do have my finger on the pulse of what is called medical tourism. People travel to Oklahoma City from all over the world. We have 2 patients coming from Cameroon next month. Mm-hmm. So they come from all over the world. They've come from UK, France, Germany, Africa, Canada, just all over the place to secure care at my facility. Mm-hmm. There are places that have names like MD Anderson, Cleveland Clinic, Sloan Kettering, Mayo, Hopkins, for pediatric cardiac procedures, Stanford. People travel from all over the world, Boston Children's, to go to these medical centers to secure care because it's the best in the world. I mean, some of these, if you need pancreas surgery, then you're at Sloan Kettering, MD Anderson, or you're at Johns Hopkins. Those are the best places in the world to get that care. So, the quality of the care, I would argue, is sporadic. But the best care I think that you can receive is in the United States. The reason the quality is sporadic and the prices are as high as they are, though, is the absence of market competition. And that's the government's fault by far and away. Mm-hmm. They are driving the getaway car every single time someone gets ripped off in this system. So the idea of throwing the keys to them and letting them take it all over is insane.
Okay, well, thank you for that. Again, I didn't want to put words in your mouth, but I'm glad it's interesting to hear you say that. So can you just help us to understand? I mean, so you I think you kind of alluded to it early on when you were just giving your initial answer to my introductory question, that somebody might think that the insurers would love you. Like, oh yeah, we're covering people, and if they can get care from, the Surgery Center of Oklahoma, then we don't have to make as high premium. Like, then we could charge lower premiums, and we should encourage all of our patients. They should be in network. We should try to funnel everybody to you guys as much as possible. One might have thought that would be what happened, but that's not what's going on. So can you explain that? Because that's kind of a mystery prima facie.
Yeah, I was terribly confused by this. And when all the pieces came together, thanks to my education by some of the people in the industry, I actually made a video called the $100 aspirin to explain it in case after my explanation now anybody wants to review. Essentially, the answer is that insurance companies don't just make money by collecting premiums, paying claims, and pocketing the difference. They also make money by charging for the discounts that they can achieve. So if a hospital sends a $100,000 bill to an insurance company, the insurance company pays them, let's say, $20,000. The insurance company then claims that they saved the employer plan $80,000, and they charge a commission to the extent that those savings are achieved. So, and it's usually 20-25%. So if you think through that, the insurance company actually wants a $200,000 bill and then accept $20,000, and then they can claim that they saved the employer plan $180,000. So the incentives are completely wrong. And that explains why the insurance companies hate me, because if I say a knee arthroscopy at Surgery Center of Oklahoma is $3,740, that's a missed opportunity for them. I mean, they have no price to discount. They have no way to reprice the claim. That's the terminology used. I call it skimming, but it's ticket scalping. My apologies to ticket scalpers, because that's actually more honest work than what they're doing. They call it claims repricing. And someone runs a $100,000 bill through a shredder, and there's $20,000 on the other side, and they claim that they saved an employer plan $80,000. Now, keep in mind, the hospital receives $20,000 and claim they're going broke, because after all, they have rendered $100,000 of care and did not receive payment for 80% of it. Well, the $20,000 they receive is 8 to 10 times what I would receive at the surgery center for the same service. So our online prices are 1/8 to 1/10 of what the hospitals actually receive, even after that discount. Now, the hospitals are happy to say they lost $80,000 because they need all the red ink that they can find to justify their not-for-profit status. And not-for-profit doesn't mean they're not making a profit. It just means don't pay tax. So they're just trying to justify their no tax status with all of this red ink. And then the federal government pays not-for-profit hospitals a kickback every year to the extent that they make these outrageous claims. So they put all of these lost claims in a bucket and kick it off to DC, and then they get a disproportionate share hospital payment to the extent that they claim these losses. So the insurance companies are incentivized to seek out the highest price they can find, and the hospitals are happy, more than happy, to give it to them. And that explains why they hate me, because there's no, the insurance companies have missed opportunity with me. Hospitals hate me because now the jig is up. The prices are online. And, why can't you do this for, 1/10? And, they're doing it for 1/10 and they're making a profit. How are you charging 10 times and not making a profit? So that's the scam.
Okay. And so then I guess kind of going along with that too, I think that all the big players in this system like the individual feeling as if, just on my own, with my own, savings that I have squirreled away over the years, if I get hit with a catastrophic illness or some kind of surgery that I need, I'm wiped out. I'm personally bankrupt. That's why I absolutely need
That's right.
my health insurance, because otherwise I'm dead in the water. And so, and I'm, the big players like the Blue Crosses, where they want people thinking that, oh yeah, you totally need us. And even like you're saying, even the major employers, need, that the health insurance company, comes in and says, oh wow, it's a good thing we outsource this to, those big health insurance companies, because they're out there, going to bat for us. Look at how much they talk down these crazy hospital bills.
That's right. The fear definitely helps the system continue. The good news is that their nightmare has begun. It's actually well underway. We call Blue, United, Cigna, Aetna, we call these networks or PPOs. And people are beginning to figure out that if they contract directly with somebody like me, they can shove that network aside and all of the network access fees, all of the repricing and skimming, and they can pay me directly and just save huge sums. So the nightmare for the carriers has actually begun, and it has been delivered by the free market, not by government, not by anybody else, but enterprising individuals have just gone to giant employers, and I'm one of them, and just said, here is what I do, and here is what I charge for it. Do you want to just shove all the middlemen to the curb and pay me directly and save 80 or more percent? And so the nightmare for the carriers really has begun. These networks are not able to instill the fear in the buyers that they have traditionally. And so you'll see reference-based pricing, RBP, and that's where an employer health plan says, we'll pay 140% of Medicare to a hospital. That's all you're going to get. And we're not going to pay you anymore. And we don't need a network. We don't need Blue, United, Cigna, Aetna, Humana to adjudicate this for us. That's just what we're going to pay. And there is no network. And that nightmare really has begun for the carriers. I don't know how they're going to respond to it.
Yeah. I mean, I want to say at this point, I could have said it earlier too, but the trump card that I play whenever, in this latest controversy and came up when this hit the news cycle again is, look, what I'm going to say isn't going to prove what the solution is, but for people to say, oh yeah, this is free market capitalism for you, I'm going to say, can you imagine if in the car market, you needed a new car or a used one, whatever, you go to the dealership, you pick the thing, you say, yeah, it's got the size I want or whatever. Okay, I'm going to have some kids. Yeah, okay, sure. And then it wasn't until you signed the deal and it was your car and now you owed them money for it, and then the dealership would tell you how much the vehicle cost. Can you possibly imagine how much more expensive vehicles would be in that setting? And yet, for most people, that's how healthcare works. You literally don't know what it's going to be until afterward, and you're not in a very good bargaining position because you're, in agony or something.
Yeah, and as my friend Jay Kempton says, the steering wheel and the tires, you find out after the purchase, are not included.
Yeah.
And all these bills start raining in after you've purchased it. So it's insane. No, there is nothing that resembles the market in the traditional industry. And keep in mind, there are two economic models at play. One, the traditional model, is how do I maximize revenue? I get emails every day from people trying to coach me. And, this is how you can make more money, how you can get more blood out of the turnip. How you maximize your profit from hand surgery. I saw that in a new magazine today. The other model is how do I deliver maximum value? And value in the eyes of the buyer, the true subjective value. And that's the model that I champion. And it is very creepy for the folks who are trying to generate maximal profit. Because if the buyer has sticker shock, they're not competitive when they're just trying to rip people off at every turn.
Mm-hmm. Okay, so can you give us an idea? So, for example, you had the Free Market Medical Association. I was a speaker at one of those events, and I was very glad to see it's not just that you're a voice in the wilderness, that you're attracting, you're building a movement, and you and your colleagues and so forth, and other people are getting involved, but yet still. It seems like how come there aren't 50 surgery centers modeled after you? Like after, your story's been around for a while. Is there some, what am I missing?
Well, there are two answers to that. The first one is you really have to acknowledge the headwinds that the traditional industry and the government provide. It is very difficult to start a facility, to get the capital for it, to herd a bunch of doctors, surgeons, and to standing behind a single idea. It's very risky. You're going to be attacked and maybe slaughtered. So the headwinds are very, very strong. The good news is there are a lot of people like me. Now, I'm a little bit of a unicorn, not entirely, I'm proud to say, because I don't have any carrier contracts. We don't work with Blue, United, Cigna, Aetna, Humana. We don't work with any of them. And we've never accepted a dime of federal money. So, and all of my prices are online. So that makes us a little bit of a unicorn, but not entirely. Renovo Health in Wisconsin, Wellbridge Surgery Center in Indianapolis, Veritas Surgery Center in Moscow, Idaho. There's a facility in St. George, Utah. The Texas Free Market Surgery Center. They all have prices online. What's really interesting is there are a lot of facilities like mine that just don't post their prices. But if you call them on the phone, they'll tell you how much the service is. And the reason for that is they are still accepting payments from Blue, United, Cigna, and Aetna, and they're afraid of Blue, United, Cigna, and Aetna. They're afraid those contracts are going to get canceled if they post prices online. And the carriers have threatened facilities like mine that if you're going to post prices, then you may have a problem with your contract with us, and then they lose access to all these patients. So there are degrees, but there are hospitals that are responding to my pricing. I'm happy to say the market is putting pressure on a lot of hospitals who are not just nefarious as Satans. They would like to help patients for a reasonable price. They just don't know how to do it. I actually run a billing clearinghouse that is helping hospitals that would otherwise price gouge people into oblivion, and we're helping them create and implement bundled prices for affordable, high-quality care. So this movement is alive and well, but most of the people are still in the closet because they're fearful of the blowback that would come at them from the industry.
Okay. Can you give us a sense to is that just going to grow and eventually solve the problem? Or is it more that you guys are great for, I don't know if low hanging fruit is the right word, but do you understand? Is it a kind of thing where, kind of routine, somebody comes in and outpatient care, you guys are great for that. But if you got to get double bypass surgery or something, you have to suck it up and go to these big hospitals and, you need your standard insurance coverage.
So right after I posted the website in 2009, I met a Canadian broker who essentially helps Canadians cross the border into the United States to secure care unavailable to them. And he called me one day and he said, he's not a clinician, he's not a physician. He said, how much for a triple bypass? And I said, well, I run an outpatient surgery center, but let me make a call. So I called a friend of mine who runs a cardiac hospital that is physician run. Mm-hmm. And I asked him, how much for a triple bypass? And he said, damn it, I knew you were going to call me after you posted this site, and I don't have an answer for you. Give me an hour. So he called me back in an hour and said, $32,000. And I said, for what? He said, for everything. So I called this Canadian broker back and said, it's $32,000. And he said, man, we're going to get them on the way. There's a waiting list, obviously, in Canada for that. And so that patient came down. Now, $32,000 is a lot of money. But when you think about somebody paying $1,500 a month for insurance premiums with a $10,000 deductible, that's 2 years of premiums. Somebody banks 2 years of premiums, they can buy open heart surgery out of pocket. Same with colon cancer, same with brain tumors. My clearinghouse is helping people secure this very complicated inpatient care for reasonable pricing. And people are willing to grant reasonable pricing because they're going to be paid. They're going to be paid quickly and without all the hassles and really threats of non-payment they encounter when they deal with traditional insurers.
Okay, well, so that's encouraging. I'm glad to hear that. This next one, I don't know how you want to take this, and maybe it's not going to be clear what I'm trying to get across here, but depending on who you're reading, it's like, oh yeah, there's just outright villains, and there's all these greedy people that knowingly are just skimming off the top and just wringing everybody dry. Whereas other people, it's more of a just hey, it's not that there's some central malevolent force here. It's just kind of there's not a lot of people that are all getting rich off this. It's not that the doctors are overpaid. There's just a lot of staff, and there's way too much bureaucracy. But those people all given the way the system works, you need somebody to push the paper around, and you got to have a whole team of people tracking down patients because they don't pay because the bills are so outrageous. It's kind of like a self-fulfilling prophecy where the bills are so big that no one's like, I'm not paying that, and then that's partly why the bills have to be so big because people know, we're not going to get paid for 3 years on this procedure we're doing. So can you just give us a sense? Do you understand the question I'm trying to get at? Like,
I think so.
Is it just a crazy system that everyone just finds themselves in? Or is it like, no, there's really 100 decision makers and they could turn this ship around if they wanted to, and they just don't want to because they like, bilking everybody?
The insurance companies, the hospitals, the price gouging hospitals, big pharma, they deserve all of the thumping that they get. But it's so important, I think, for everyone to remember who the true culprit is. And that's the federal government. This system everyone hates is downstream of an auction in D.C. that if the auctioneers have sold all of these favors to the highest industry bidders. So all of the big industry players have paid dearly for the ability to fleece, essentially, the American public. A lot of the revenue that these insurance carriers and hospitals receive comes from the federal government. They're directly plugged into the trough. In addition to fleecing Americans directly, they fleece everyone indirectly. So it's the game. I mean, it is what it is. It's working exactly as it was designed by these people who have cobbled it all together. I don't think it's fixable. I think it is completely unfixable. I think it can be destroyed. But the only way it'll be destroyed is if there's a market alternative. And that's what I'm focused on. Have market discipline regulate this industry, not the corrupt feds and regulators. They're all completely bought into this system that's a disaster. So I don't think it's fixable, but there are a lot of people who do not provide direct patient care. There are a lot of people that are not providing value of any kind. They're getting rich. And I'm here to tell you, physicians are not generally in that group. The doctors are not getting rich. The doctor's pay has been stagnant or dropping for years. But if you walk outside, you don't have to walk very far before you see a gigantic crane building on to a not-for-profit hospital or putting up a new billboard, or you go to a professional sports game of some kind, and there's all the advertising that is so expensive. And so you can follow that money. Are these people inherently evil? I'm inclined, and many of my friends will be disappointed for me to say this, I'm inclined to agree for the most part with my friend Marty McCary that these are oftentimes initially well-intentioned people who get into this industry for the right reasons, and then they're consumed by it. And in fairness, the headwinds to change anything are so vicious, and all of the resistance to change comes from DC. And I think it's important for people to remember this because the government is responsible for every part of this healthcare system people hate. That they are the ultimate culprit. So, we have my friend Jim Epstein from Reason Magazine told me one time the way he finds a great story is he looks for industry consolidation. And that's the business of government, is to crush competition so we have consolidation, not a huge number of new upstart competitors trying to get into the game. After Obamacare, there were 4 insurance companies, basically. Before then, there were a whole bunch. So what do you expect is going to happen to pricing? Well, that was just a huge favor to the industry, and the industry lobbied for it. And everyone was bought off. The AMA was bought off in the early 90s. Big Pharma was bought off during Obamacare when they promised them to make imported biologic drugs illegal for 20 years. And the hospitals were bought off by Obamacare when they promised to make physician ownership of hospitals illegal. And all of these favors are passed out that protect them from competition. And, are there people seeking these favors to the disadvantage of their competitors? Absolutely. But that's been going on in every industry in this country forever.
Mm-hmm. Okay. Well, I guess the last question I have for you is, and this is an interesting moment in history here, because not just me personally, but lots of people who are going to hear this interview may have inroads into, a way to run things up that Vivek Ramaswamy or Elon Musk is going to be able to get a hold of. So if Trump's team were to ask you, we listened to this, we're on board, we got a lot of entrepreneurs who are involved in the transition team, what can we do that, and again, you can couch it in terms of politically possible or not, however you want to answer the question, but what can we do to make this better?
There's some things that could help a little bit, but again, the system that's cobbled together is designed to work the way it works. So fixing it means dismantling it. Dismantling it begins with removing price controls. For instance, physicians are only allowed to charge Medicare patients a certain amount. And that price control has caused real access issues for Medicare beneficiaries. So they need to remove price controls and then begin to completely dismantle the Medicare regulatory machine, which essentially calls all of the shots. We need more insurance companies. These big companies, they need competitors. They don't have competitors out there because of this minimum loss ratio. These giant companies can stand this 30% minimum loss ratio, but the little ones can't. And that's why that was part of Obamacare.
Can you explain what that is?
So, this sounds great, and it's horrible, but an insurance company was not allowed to keep more than 30% of its revenue as administrative overhead. Well, if you're $1 trillion company, then that's a lot of money for administrative overhead. But if you're a small insurance company, 30% year in, year out may not be enough. So that's the reason we have 4 insurance companies. There were only 4 that could endure this minimum loss ratio. So that needs to go away. I tell people that the way to fix it is to not pass any new laws, but to repeal all of the ones that have been passed up to this point that apply to the industry. And high tech that required basically the use of electronic medical records when it was not clear at all that there was a market for them. And instead, what we ended up with is this electronic medical record in which it's almost impossible to find any pertinent information whatsoever. So there's a lot that needs to be undone before anything innovative should even be considered. And then all of the sandbagging and roadblocks that stand in the way of entrepreneurs rising up and starting, facilities that are willing, like mine, that are willing to endure the discipline of the market. That's really what will make the horrible system that's been cobbled together change.
Okay, well, that's a good spot to end this discussion on. Folks, my guest has been Dr. Keith Smith of the Surgery Center of Oklahoma. Keith, thanks so much for what you've been doing and taking the time to come help us understand it.
Thank you, Bob. Thanks for having me.
Thank you, everybody, for tuning in. We'll see you next time.
Check back next week for a new episode of the Human Action Podcast. In the meantime, you can find more content like this on Mises.org.